Hi guys, this is Dr. Bhupesh from Dr. BKMOIT Institutes. Again, we are taking a random listening today and we are trying to record the part C. I will let you know about each and every step and all the thoughts that will come in your mind when you are executing the part C. We have just finished with the part B and have gained some insights about the methods. And let's see the part C. I have also not done this part C. This I am doing for the first time, and I will tell you step by step what do we need to do in the part C. So I'm just gonna play it from here where the part C is starting, and seriously, I swear I don't have any idea about this.
Now look at extract one.
Yeah.
You hear
Okay.
special.
So first of all, in the exam, you will get this type of thing that listen to the extract one. Then the first of all, the first thing that you will do when you will get 60 to 90 seconds, you need to read only the questions. What is the started purpose of the talk? What is the stated purpose of the talk? So what is the purpose of the talk? What did the research from the Mayo Clinic show? So now you can understand the topic. They are talking about a clinic and they are talking about a research. Okay. What is Anna Capstone's attitude to the problem of burnout? So Anna Capstone, never read this name again and again complete. So you call it AAC. What is AC's attitude? What is the attitude of this person to the problem of burnout? So burnout, there should be a problem of burning out, maybe exhausting. Burnout seems like a word for exhausted. So they are talking about purpose of the talk. Always try to remember purpose of the talk. Then second question about the research. Third question about the burnout. And AC attitude. What is the attitude? That is the main question. How does AC think? Now this is saving your energy rather than, this is very important guys. Save energy. Don't speak the complete name. How does AC think the problem of burnout should be addressed? So first she was talking about the attitude, that what is the problem of burnout? What is the attitude? That attitude means what does she think about the problem? And then she's talking about the solution. What does AC think about the problem of the burnout should be addressed? How it should be addressed? Matlab, how it should be treated. How does AC evaluate the role of administrative technology and regulations? Now she is going to talk about the administrative technology. AC argues that protecting the well-being of highly trained medical staff. So now we can understand the topic. The topic is majorly about burnout. Topic is majorly about AC. AC must be a writer or maybe a doctor, a researcher. And she's going to talk today about, first of all, what is the purpose of the talk? Second, she's going to talk about the research. What does the research show? That is how you should remember. When you read only questions, you remember the story. So now I can understand today there would be a person AC. She's going to talk about the purpose of the talk first. Then she will talk about the research. Then she will talk about the problem of the burnout. Then she will talk about the treatment of the burnout, that how burnout should be addressed. Then she will talk about the role of administrative technology. Then she will talk about how to protect the well-being of the highly trained medical staff. So this is very important because now if I close my eyes, my mind would be talking about the thinking about the topic without listening to it. Purpose of the talk, maybe she's going to talk about burnout today. Then she will talk about the research. Then she will talk about the problem of the burnout. Then she will talk about the treatment. So now I understand what she's going to talk about. And then you will read this question. First question you should read before they start speaking. So you will have enough time. Now you have read the questions and I will play it. And by the time I will read this thing, that what is the purpose of the talk? To evaluate if the audience are feeling burnout, to inform and stimulate discussion about the burnout. So first is to evaluate. Evaluate means assess. Evaluate means assessment. So assessment, or the second option is inform and stimulate discussion. So whether she want to assess or whether she want to stimulate discussion with the audience, or to describe new research. New word is very important. Describe new research on the treatment, but the topic is about treatment, so this can also be answered, because the second thing they are talking about research, then they're talking about treatment, so it can also be the answer. So generally saying, I feel like this can be the answer because now I know the topic at the end is going to go towards the treatment, so it can be the purpose of the talk as well. And new research, now she's going to talk about the research as well. So C can be the answer. So that is how your mind starts working when you follow the right strategy. So again, right strategy is reading the questions, then reading only the options of the first question by the time they start speaking.
In medical ethics called Anna Capstan, giving a presentation on the issue of burnout in the medical profession.
So Anna Capstan talking about the issue of burnout in the medical profession. So that's why in the last she will talk about how can we prevent the burnout, the exhausting. How can we stop exhausting of the medical staff? So this would be the last thing. So now you have the time. So I'm making it forward. So by this time, whatever the break is, 60 to 90 seconds, I will try to read all the questions and option of the first questions.
Hi,
Okay. That's it.
I'm Anna Cadston from the Division of Medical Ethics at University College. Today, I want to discuss the quite urgent topic of burnout among medical professionals as it's becoming. It's kind of an epidemic, but I really think that we're not talking about this enough. That's why we're here today, to get a bit of information out there and start a conversation.
That's why we are here to discuss today about bit of an information, and she was talking about conversation. So maybe she is here to inform and to stimulate the discussion. So that I feel now the answer should be B, but obviously I will take your help beyond any doubts. But before I do B, I want to listen to it again because again I'm recording it, so I want to make sure we are going in the right direction. Let's
Quite
listen to it.
urgent topic of burnout among medical professionals as it's becoming. It's kind of an epidemic, but I really think that we're not talking about this enough. That's why we're here today, to get a bit of information out there and
we
start.
are not talking about it enough. So we are not talking about it enough. That means we are not discussing it. So that's why we are here to discuss about it.
Conversation. So, what is it? Well, burnout is a psychological and behavioral syndrome.
Now she will talk extra. So the first answer should be B. I want to take your help because this is my first question. I don't want to do it wrong. But if there is any answer, that means she would speak about it. But I think it should be B. It doesn't seem like difficult question. What's the answer of 2031st?
Sir B.
Sir, B is the answer.
So again, in the exam, out of 6 questions, half would be easy, half would be difficult. So if 3 are easy, like this first question, if 3 you can do right, 3 if you can do right, out of the rest 3, even if you do 1 right, you will pass. 4 out of 6, again part C, 4 out of 6. And then in the part B, 4 out of 6. 4 plus 4 plus 4, 12 out of 18. Part B and C, 12 out of 18 is very good. Then you score 20 out of 24 in the part A, all good to pass. So please believe in these numbers. Don't think about all the questions would be easy in the exam. If 3 questions are difficult in listening, don't think that today paper was difficult. Obviously, 2 or 3 questions would be difficult out of 6. So don't worry about it. If 2 questions are difficult, if you can do other 4 right, then you will pass. And if out of 2 difficult questions, you can do 1 right, then 5 out of 6. You will pass by 400 marks. So think like this. Don't worry if 3 questions are difficult. Try to find 3 easy questions, get them right, like this question. And thanks to this online classrooms who have ever prepared this listening, thanks to them. Again, being Dr. BKM Institutes, my job is to tell you how to do it. So it's a random listening I'm playing. So thanks to them, at least I have a question paper to play. All right, I'm muting you again. Now I'm jumping on to 32nd question. And 32nd question, now again, I already know the question. My topic is about research. What did research show? Did means in the past. Don't forget the tenses. Tenses are very, what did the research show? That means they're talking about the past research. Let's see and let's play. Okay, and by the time she is going to talk randomly, you should read this question. So by the time she will be speaking, now I would be reading the options because question I already remember. As I told you, I have read all the question. First question about purpose, second about research, third about burnout, the problem, fourth about burnout treatment, fifth about administrative technology. So I've already done everything. Okay, so I'm just gonna play it now, and we'll go forward. Let's see the other questions. Okay.
Emotional exhaustion is one quite
So
common.
by the time she's talking random, I'm gonna focus on this data. So when I will read it, because I cannot read it side by side, so I'm just gonna play it, and side by side I will keep reading it. Let's see.
Hallmark of burnout. It's been defined as long-term, unresolvable job stress, a sense of being overwhelmed and depersonalized and lacking a sense of personal accomplishment. A recent
Okay. So by the time she's talking now, and now she's about to say the research. Trust me, I have read three important things. First, in the first, if she specifies the number 2000, 2011, more than half means more than 50% claim to have burnout. So either the research showed this. Second, large number of doctors. So more than 50% can also be called as large number of doctors. But now in this option, the different part is continuing to rise. That means, are they still rising? That is the question. So A option would be right if she talks only about that half of the doctors, more than half of the doctors, more than 50% of the doctors were having burnout. Then A will be option. And if she says that lot of doctors or more than 50% of the doctors had burnout and they are still growing, they are still rising, then B would be my option. Third, she's saying only one aspect of doctors makes them burn out. So if she would be talking about a particular aspect, that would be my answer. But the main thing that you can learn while doing this OET listening is that by the time she's speaking extra things, you can read all these three options. And now you will see she's just gonna start about research.
study from the Mayo Clinic,
Okay.
personal accomplishment. A recent study from the Mayo Clinic showed that in 2011, 45.5% of doctors reported that they felt burned out.
Now this is elimination method that we use in reading as well. 45.5, that means less than half. A option is eliminated. That means now I am confused only between B and C. So I leave this option. So this saves my energy. Now I am focused about these two options only. Let's listen to the rest of the conversation.
And that number has now risen to 54.4%.
So the number has now risen to 54%. That means the research, after the research, the number is increasing. 45.5% is a large number of doctors. So B can be my answer. But let's listen to the until the last.
2014. More than half of all doctors in this country are saying, I really feel that some aspect of my work as a doctor is making me feel burned out. This is really trouble. It's trouble because a doctor who feels this way can commit more errors. They suffer from compassion fatigue or just not being able to empathize with others because they have their own emotional issues. They may retire early.
All right. So now we would like to do question number 32. And as per me, question number 32 answer should be B. And if you tell me it is right, then I will explain you why. What is the answer?
Sir,
B.
B is correct answer.
Okay.
B,
Now, guys, if you want to score 450 in listening or A in listening, you need to understand this thing, guys. That is what I teach you in reading. That is what I will teach you in listening. That is what is the reality. How did I do this? A, she said 45.5%. Wrong. B, she talked about that the number has risen to 54% in 2014. Yeah. So that means it is continuing to rise. C option, do you know why did I eliminate? That is why I tell you, read the question carefully. So she was talking about research that happened in the past. But C option, she said, now the doctors are experiencing. So the word having now, current, today, cannot be the answer of this question because my question is in the past. My answer cannot be in the present. Let me make you listen to it once again. This is very important, guys. That is where we lose marks in the final exam. Please listen to it.
0.4% in 2014. More than half of all doctors in this country are saying
More than half of this doctor in this country are saying. That means it is not the part of research. Are saying means they are talking in the present. But my question was, what did the research show? So that was the thing. Now she is talking about more than half of the percent doctors are saying. So this cannot be my answer just on the basis of the tenses. Again, if you can learn this thing, if you can learn this trick, again, why wouldn't you score 450? Or obviously that will happen. Listen to it.
0.4% in 2014. More than half of all doctors in this country are saying, I really feel that some aspect of my work as a doctor
I really feel present tense. My question was in the past tense.
making me feel burned out. This is really trouble. It's trouble because a
Now she's saying it is trouble. That means now AC is talking about the attitude. Now I have got this option. Let's see what she is talking about. By the time I will not stop her, stop this listening, because in the final exam the listening would be played and I have to read the options simultaneously. Let's see what she is saying.
doctor who feels this way can commit more errors. They suffer from compassion fatigue or just not being able to empathize with others because they have their own emotional issues. They may retire early, therefore reducing the workforce.
Now guys, again 33rd answer, I also need your help again. And as per as I have not even read, I have not even listened to whole of the topic. Still I believe 33rd answer should be C. If it is not C, then I will listen to it completely. Otherwise, I'm done with even 33rd. What's the answer of 33rd?
The C.
And now I will tell you the reason. Because she is saying that most of the doctors cannot handle the burnout because they feel loss of empathy. A, eliminated. Because A option says that doctors can handle the burnout. Eliminated. Then she is saying again tenses, yaar, tenses. Doctors with burnout may retire. She is not giving suggestion should retire. Rather, she is saying may retire. That means she is not happy. She is not giving suggestion. She is not saying doctor should retire. She is rather sad that doctor may retire. So you have to understand the tenses or the modals. Let's listen to it again. These are modals, obviously, but I call it a part of grammar, so that's why I'm calling it tenses. But grammar is very important, guys. And listening and reading, some of the questions can be done by just with grammar. Listen to this again.
Or errors. They suffer from compassion fatigue or just not being able to empathize with others because they have their own emotional issues.
So they have
They
they have their own emotional issues, means they cannot handle the stress. They cannot handle the burnout.
Hire early, therefore reducing the workforce. Empathize with others because they have their own emotional issues. They may retire early.
They may retire early. That means she is not happy with it. They may retire. So she is not saying they should retire. So that's the only thing. You eliminate A, you eliminate B, and C becomes your answer.
Therefore reducing the workforce. They may have problems managing their own lives. 400 doctors committed suicide last year, which is double the rate of the population average. There's trouble for patients in having a workforce that's burned out. There's trouble for doctors in
So
terms
there is trouble for doctors, there is trouble for patients. That means they are endangering patients and doctors both. We are just going to do the last question, guys. This one, I don't want to do whole of the listening because these three questions will let you know what I want to teach you. Again, it's just about the purpose, just about the tenses. So when they were talking about the purpose, she said that's why. So the words like that's why, so, therefore, that is why we are doing this thing. So these are very, very important when it comes to purpose. Anything in the reading or listening, when they say that's why, so, therefore, that is the reason, of the purpose. That is the reason of the aim. Questions like aim, purpose can be done with the words like that's why, so, therefore. Then we did this. What did the research? The only thing I eliminated this option is on the basis of tenses, because she said doctors are saying, and it was about what did research. So my observation was not wrong when I was telling you did is very important. And then in this questions, doctor may retire, doctor should retire is a suggestion. She is not giving suggestion, she is telling about the possibility that may happen. So again eliminated. That is how reading part C should be done. Last question we are doing just out of comfort, and please listen to it till the end, because this seems like a big question, should be difficult. And by the time I will read this question, obviously I already remember how should it be addressed. So I already remember the question, how the problem can be solved. By the time she will speak, I will read the options in the final exam.
Of their own health and well-being. We don't talk about it much. We like to think that doctors can handle everything, but it's clearly not true.
Now I have read all the three options. That is how fast I am. But that is how fast you should be. But I have not read everything. Again, in the first question, I told you, in the part B, when we were talking to each other, I was telling you about the nouns. So now my main words that I have found as a part of noun is hospital should fund. That means financial help. Multiple strategies means if with the money she talks about anything else, like say she says money, but apart from the financial things, doctor should be given counseling. So that means multiple strategies. So that can be the answer. And then by discouraging the doctors from losing empathy and making mistakes. So this does not seem like answer. But if they will say that doctors should be told to lose empathy, of doctor should not lose empathy and should not make mistake, then C becomes my answer. But I don't think generally in reading C should be answered that by discouraging the doctors. So it should be funding, financial help, or if she talks about more than financial help, that means she is talking about multiple strategies. So by the time she is speaking, I have read all the three important words: multiple strategies, funding, or discouraging doctors, empathy. Let's see.
It's a problem, and there ought to be some solutions. One type of fix is to make sure that hospitals.
See, by the time she is speaking, now I have all the time in the world to read again and again. Funding, multiple strategies, empathy. Funding, multiple strategies, empathy. And question I have already read in the first 60 to 90 seconds. And the best strategy, again, I'm reminding you, only the questions first. Don't read the options in the start. Please don't read it. Only the questions. In the reading part, B and C or whatever you are doing in the reading part A, only questions, don't read options first. First of all, read the question, then read the paragraph, then do the answer. Don't read the options in the start. Never, neither in the listening nor in the reading. Please listen to it, the last question.
Other healthcare environments try to create better conditions for a happier workforce and for happier doctors.
So basically they have to create environment. So environment is one of the thing that should be created. First is environment.
This might include yoga, mindfulness training, having more therapists to talk to, encouraging people to come forward when they feel this way, peer groups, and better mentoring. There are a lot of tactics that we could pursue and try to engage in. I'm not sure what's best, and maybe one size does not fit all, but it's time to really build a safety net so that we can keep our workforce functioning and we keep physicians at their career.
So now she has not talked about any funding, but she has talked about wellness programs. Yes, yoga, everything comes as a part of wellness programs. But I'm not quite sure whether she has talked about funding or not. She has talked about environment, but she has not talked about money. Then she has talked about there are multiple things that can be done. One size do not fit all. That means one shoes does not, that means one strategy is not applicable to all doctors. So that means you need to have multiple strategies. I would like to listen to it again just to know whether she has spoken the word funding or not, just for this word. Otherwise my answer is B, but still I will still do it again just because we are practicing and we should know what we are doing.
Mentoring. There are a lot of tactics that we could pursue.
Lot of tactics means lot of
Happier
strategy.
workforce and for happier. It's a problem, and there ought to be some solutions. One type of fix is to make sure that hospitals and other healthcare environments try to create better conditions for a happier workforce and for happier
So she is saying trying to create better conditions, but still I believe she's not talking about money. Obviously, I understand better environment will be created by money, but still she is not talking about funding.
doctors. This might include yoga, mindfulness training.
But yoga, mindful training, all is a part of wellness program. But still, I believe she's not talking about funding.
Having more therapists to talk to, encouraging people to come forward when they feel this way, peer groups, and better mentoring. There are a lot of tactics that we could pursue and try to engage in. I'm not sure what's best, and maybe one size does not fit all.
And I'm not sure what is best. Maybe one size does not fit all. So I think answer should be B. I want to take your help and just wrap it up. What is the answer of 64th? Oh,
B, sir.
34th? Sorry?
B.
Then it's fine.
B, sir.
So that's great. We have done first right, second right, third right, fourth right. I have already scored 4 out of 6. Why to worry? So this is how listening should be done. I'm not saying all the questions would be this easy in the exam, but at least 4 out of 6 questions would be this easy. I guarantee you. And if you score those 4 out of 6, you will pass. This is Dr. Bhupesh from Dr. BK Moit Institute. Please subscribe our channel if you have not. Thank you. Thank you.